You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's episode, we will be discussing kidney problems. And kidney issues are extremely common globally. In the United States alone, we have over 30 million people who have some form of chronic kidney disease. That represents almost 10% of the population. Now, when I talk about kidney disease with my patients, I always like to break it down into simple terms. So the first terms that I like to break down are acute kidney disease versus chronic kidney disease. So an acute kidney disease, also called AKI, or acute kidney insufficiency, also called acute renal insufficiency, basically there is an identifiable cause that is reversible. So if somebody has a kidney issue, they come into my emergency department, for example, they're not able to produce urine, or they're very, very sick, they have some other type of infection, it's possible that their kidneys, both of them, are starting to fail or shut down. If we can identify the source of that problem, correct it as quickly as possible, the kidney will recover and they will not have any long-term damage. So that's the definition of acute kidney injury. With chronic kidney disease, that is something that is irreversible. So perhaps someone has a disease, for example, diabetes or high blood pressure. They've had it for at least 10 or 15 years. Maybe they've taken care of their health. Maybe they have not. But over time, the kidneys have become very, very stressed. And so each month or each year, they've been losing a certain percentage of their kidney function, and that will not come back. No matter what medications we use, no matter what treatments are offered to them, those kidneys are permanently damaged. And so chronic kidney disease has stages, and those are stages 1 through 5, basically mild, moderate, and then severe, basically end stage. So in chronic kidney disease, even if we can find the source of the problem, we are not able to correct it, whereas with acute kidney disease, we can. Now, what is the function of the kidney? Why were we given 2 kidneys instead of 1? Why are they so important to the human body? There's a couple of reasons, and sometimes I use analogies to make a point clear. One is, what is the difference between a human and a fish? And basically, it's the kidneys. So people always think first it's the lungs, that we have lungs and therefore we are different than fish. That's why we can't live underwater, and that's why fish can't live out of the water. But it's actually the kidneys, because the kidneys are what keep our water content inside of our body, and they respond to all kinds of external challenges to keep our blood pressure, to keep everything filtering at a balanced level. So between fish and humans, it's possible fish could live on land if they had better kidneys. It's also possible we could live in the water if we had other structures, but the kidneys are so vital to human life that we were given 2 of them. Now, it is actually possible for people to be born with only 1 kidney and live their entire lives completely healthy. And at the time of their death, if someone did an autopsy, they would find out, oh, this person only had 1 kidney their entire life. They played sports, they had children, they grew old, they had all kinds of other activities, and nobody ever knew. So the kidneys are highly efficient. So even with 1 kidney, people can live a very full and healthy life. Now, even from that 1 kidney, let's say up to 80% of that is damaged, it's possible that person may still not have any symptoms. They could eat regular foods, they could go travel, they could work in a regular job, and they could still function with even 20% of that last kidney's reserve, as long as nothing else tips them over in a bad way. So that's the reason we have 2 kidneys. In case one is damaged, the other will compensate, and even within the kidney itself, we have some reserve. Now, the cells in the kidney that actually do most of the work are called nephrons. So nephrons are very specialized cells. The purpose of a nephron is to filter the blood and to carry out the waste. Now, waste products can include things like urea, which is where the name urine comes from. It's also other waste products from medications, foods, other things that we ingest, and so forth. Now, even when the kidney produces urine, there are some things it throws out, but it changes its mind and it wants to bring them back in. So, for example, sugar. So people eat sugar, they have sugar in their blood, they have glucose circulating through their body, the kidneys will filter it out, and the body may say, well, let me hold on to that sugar. So it actually goes back and takes it before the person urinates that out. And the same thing can happen with sodium and potassium and calcium and other electrolytes in the body. So the kidneys have a unique way of maintaining the balance, not just filtering it once, but filtering it and then deciding what it changed its mind about and bringing it back into circulation. Now, one of the issues that we do worry about is the potassium. So potassium is actually life-threatening. It's lethal in very high doses. So in the normal human person, a normal value is about 3.5 up to 5.0. So those are very, very small numbers. So between 3.5 and 5.0 is considered normal. That's a range of less than 1.5. People who get up into the 6.0, 7.0 range can have sudden death. So people who have kidneys that are beginning to fail, whether it's acute kidney failure or chronic kidney failure, if the potassium level increases in the blood, those people will die. So one of the most important functions of the kidneys is actually to filter out potassium. And that's why we have to always monitor those lab values whenever we do testing. Now, what are the common lab testing? How can we diagnose kidney disease accurately? So the best way to do it is with a calculation based on the creatinine and the GFR. So creatinine is actually a muscle protein that's broken down. So throughout the human body, for example, if someone weighs, let's say, 150 pounds, each day they have a certain amount of protein that is broken down into the blood, and then the body rebuilds the muscle mass and the bone structures and so on. So the creatinine that's in the blood is actually filtered by the kidneys out of the body. So it's normally a very small amount. So we measure in things like 0.5, 0.6, 0.7. If suddenly the creatinine level increases, it goes up to 1.5, 2.0, 2.5, we identify that the kidney is having issues. So whether it's acute kidney failure, meaning it just happened yesterday and the creatinine doubled overnight, or if it's been developing over time, a slow progression, the creatinine allows us a lot of information. And it's actually from the muscle mass. So again, every day we break down a little bit of muscle, it's in the blood, but when it starts to accumulate, the kidneys have more and more stress. Now, the GFR is actually a calculation. So this is based on a person's weight, whether they're male or female, and it's actually the glomerular filtration rate. So the glomerular portion is with the nephrons. That's the specialized cells, and the filtration rate is how much urine, how much blood, how much circulation is actually going through the kidneys over a specified amount of time. So the creatinine provides us the basic information. The GFR provides us even more detailed information. Now, whenever we talk about testing, we always have to test the urine itself. So if somebody comes into my emergency department or to a clinic or an urgent care and they have symptoms that look a little bit suspicious, we're not quite sure where it's coming from, check the urine, because the urine never lies. It's a weird thing to say, but it's actually very true. We test for about 10 different things in the urine, and people can say, for example, I'm diabetic, but I take really good care of myself. I always check my blood sugar, and I'm doing really well. If we check the urine sample and there's a large amount of urine, we can say perhaps they're not truthful. Maybe they have not been taking their medications. We can also test for things like drugs. So urine drug testing is very accurate for most people. We can also test for things like protein in the urine. So protein, again, like the creatinine, it's from the foods we eat, it's in the muscle mass, and it goes throughout the body. It has a purpose. The kidneys are designed to filter out some things and to keep some things. So in this case, if we see a large amount of protein in the urine, that's a problem. That means the filters are not working. And when the microproteins, called microalbumin, are present, that's one issue. When we see the macroproteins, meaning the larger and larger protein molecules, that means the filter itself is starting to break down rapidly. So we can actually identify a lot of things very quickly by looking at the protein, whether it's micro, macro, or something else in the urine sample. And then we can also test the concentration of the urine. So, for example, if you wake up first thing in the morning and you haven't had anything to eat or drink and you urinate, the urine tends to be very dark. It's going to be concentrated, might have a little smell to it, dark yellow, dark orange. Later in the day, if you have a lot of water to drink, if you have other activities going on, and then you urinate several times, you'll see that it becomes lighter in yellow. And some people who drink a large amount of water or other liquids or receive IV fluids, their urine is almost clear because it's so dilute, it's actually going through the kidneys very rapidly. So the urine concentration provides us a lot of information. Now, people with kidney failure, again, they lose protein. They're also losing their ability to concentrate the urine, and over time, they just stop making urine altogether. So all those bad chemicals, the potassium, some of the toxins, the urea, builds up in the blood, and those people become very confused. They become sedated. They're not able to function. They become very weak, and many of them can actually die if they don't receive urgent treatment. Now, what are the common causes for kidney failure, whether it's acute or chronic? So with the acute kidney failure, there's several actually medications that we worry about. And one of the most common are called NSAIDs, which are anti-inflammatories. So these are things like ibuprofen, Aleve, other medicines like Excedrin, aspirin. These are all very stressful to the kidneys. So people who take a large amount of ibuprofen, let's say they play sports, or they take a large amount of Aleve, let's say they have chronic migraine headaches, or they have other back pain, they take them every single day. The kidneys are responsible for filtering out all of those chemicals. Over time, the NSAIDs, these anti-inflammatories, are toxic. And so people can develop kidney failure just because of taking over-the-counter pain medications. Another category of medications are antibiotics. So antibiotics are designed to kill bacteria, but in high doses, they can actually damage the kidneys. If it's identified quickly, it's reversible. But if those people are on it at high doses for a long period of time, then it becomes chronic and irreversible. Other things can include vomiting, diarrhea, and these are called hypovolemia, meaning if you're vomiting multiple times throughout the day, you have severe diarrhea for 2 or 3 days, maybe you traveled, you got really dehydrated, you don't have any liquid left in your blood, and so the urine can't be formed properly. So in those cases, it's too concentrated, and the kidneys don't like that, and it causes them to, again, shut down. The best treatment for the vomiting diarrhea is to correct it, either with medication, give them IV fluids, give them other supportive care, and the kidneys will wake up and do their job more efficiently once again. And then even things like burns. So there are people who've had a chemical explosion, or they were involved in a severe burn at a house fire, or maybe they work in an industrial facility where there's accidents. Burns actually cause damage to the skin, which is supposed to keep all of the liquid and the electrolytes and other particles inside the body. So when a person is severely dehydrated due to burn treatment, kidney failure is a very, very high risk. And then there's other causes that would be more technical, things like chemotherapy medications, contrast dye. For example, if someone has a CAT scan or an MRI, they may receive an injection of a dye that could actually permanently damage their kidneys. And that's why many places require blood work before they allow you to have a CAT scan or an MRI for safety. And then things like cancer, drug abuse, alcohol, even blood clots can cause kidney failure. Then there's 2 categories that are unique because they can occur in perfectly healthy people. So one would be a kidney stone. So kidney stones can affect men and women. Kidney stones are often made of calcium or oxalate or other crystals. They develop over time. Now, when kidney stones form in the kidneys, you have no pain because they accumulate over many months or years. The problem is that when the kidney stone decides to move, it goes down the tubing, which is very, very narrow. So, for example, if the tubing from the kidney to the bladder is only 1 millimeter, most stones are 5 or 6 or 10 millimeters. So that's a very large amount of space going through a tubing. What happens is the stone becomes stuck. And so the urine, even if it's developed in the kidney, it can't go down. It becomes blocked, and the urine backflows. So we call that hydronephrosis. Hydronephrosis is swelling of the kidney because the urine has nowhere to go. It's all backflowing. Just like in a sink or in a bathtub that has a blockage, if you keep adding water to it, it's going to overflow. So in those cases, people with kidney stones sometimes have to go through surgery, or they have to go through lithotripsy, which is a process where they break up the stone to allow that kidney stone to pass down and then allow the urine to go and allow the kidney to go back to its normal size. So if it's identified quickly, this is one of those acute kidney injuries that's reversible. If it's not diagnosed in time, or if it's on both sides or chronic in nature, then it can become a permanent problem. And then the same thing with the urinary issue would be the prostate in men. So many men after a certain age, usually in their 50s or 60s, will develop prostate enlargement. And it presses on the urethra, it presses up towards the bladder, and again, it blocks the kidney function just like a kidney stone would. In those cases, severe cases will require surgery to basically reduce the size of the prostate and allowing the kidneys to function, to create urine, and allow everything to flow downward. Okay, so those are all acute kidney injury reversible causes. Now with the chronic kidney disease, which again is over time, and these are oftentimes irreversible, there's a couple of common causes. The number 1 cause is diabetes. Number 2 cause, high blood pressure. So those 2 things alone make up more than 90% of the causes of chronic kidney disease. And in the United States alone, 50% of adult Americans have either diabetes or they have high blood pressure. Many people have both. So you can see if you have a person who's 35 years old, 40 years old and they're diagnosed with diabetes or high blood pressure, over the next 10 years, we have to be very cautious with their kidney function, because otherwise they will lose their ability to make urine, and that will result in a decreased quality of life and death prematurely. So diabetes